So I am calling this regular board meeting of the Sunshine Coast Regional Hospital District to order at 1:15 p.m. on July the 18th, 2024. And I'd like to acknowledge that the Sunshine Coast Regional District is located on the territories of the Shishel and Squamish Nations. I apologize for starting a little late. We had an important learning session as a board, and thank you for everyone's patience here. So first we need to adopt the agenda. Moved by Director Toth, seconded by Director McMahon. All those in favor? The motion carries. And we have minutes to adopt on pages 3 and 4, Annex A of our Hospital District meeting of April 18th, 2024. Moved by Director McMahon, seconded by Director Toth to adopt those minutes. All those in favor? Any opposed? The motion carries. And now we have a presentation from Vancouver Coastal Health. So welcome Johan, who we're all familiar with, and Sammy is here as well from Vancouver Coastal Health to make this presentation. Welcome, and go ahead.
Thank you very much.
Your mic on.
I just want to make sure that I can actually move the presentation. There we go. Thank you. Good afternoon, and thank you very much for...
And could you speak direct? That mic needs to be pretty close.
Thank you, sir. Good afternoon, and thank you very much for having us here to speak to you this afternoon. I want to just say that the capital update is really intended to address our requirement under the Memorandum of Understanding, just to set the stage for that. The territorial acknowledgement, you've already done so I'm going to skip that. Thank you. And just want to speak to the general alignment with our investment to our strategic priorities. First priority being exceptional care as timely access to high quality care for the best health outcomes, research and innovation for impact, a vibrant research and innovation ecosystem for better health outcomes, and a great place to work, and that is with reference to our staff, and healthy people to support optimal health and well-being by addressing social determinants of health. The capital planning principles in general, and I won't go over all of them, is really based on operational sustainability. In other words, keeping the doors open at all times. The asset condition. Asset condition is in particular referring to some of our older facilities where we continually have to renew the core infrastructure within those. Indigenous health is a focus area for us in terms of ensuring that we are supporting it throughout capital, regardless of the capital project. Similarly, for planetary health, diversity, equity, and inclusion, where we can, we include those within capital projects, even for infrastructure projects, if possible. The overview, just at a very high level as to what we are focusing on within the next couple of years, it being long-term care, the what we now term the health vision, which was formerly known as master site planning, emergency department renovations. As you can see, there's one underway at the moment here. Mental health, substance use, surgical services, diagnostic imaging, our infrastructure deficit, community services, and lastly, the clinical system transformation project which is still to be rolled out completely within the rural areas. So we are looking at Pell River as being the last of our acute sites. And then we are working provincially on a brand new ERP system and focused on various Indigenous health initiatives, which we support in general. This is a snapshot just of coastal, so coastal COC only. In the past, what I have presented to you was the total capital plan for VCH, and I think it's probably a little bit more appropriate to really just focus on coastal. So in total, we have around 98.6 million and 36.4 million, which includes the Lionsgate acute care facility that's being constructed right now. But looking at the total revenues over the next 4 years, we are at 98.6, 36.4, 7.4, and 1.3. The reason why it kind of drops off is that our funding envelope from the Ministry of Health is spread over a 4-year period, which we get on an annual basis. So you kind of always see this trend of things dropping off towards the latter years. A very quick view on the expenditure side. Some of our key projects are listed here. Firstly started with the pharmacy renovation at Cathet, the emergency department renovation that's underway here at Sechelt. There is a modular CT scanner for Squamish General Hospital. And then more on the acute side are the other 3 projects which is sitting in Lionsgate. When we had the joint meeting last year, and I know that not all of you were at that meeting, but we were sharing the impact of our prioritization process in terms of the amount of requests that we have received within the health authority from all of the areas, including Providence Healthcare. And that was around 350 million, roughly. Our total allocation is just over 55 million. So there is a lot of stuff that's been requested that will be deferred into the future because we simply could not meet that. But in view of that, this is where we are today for FY25. So of that 55 million, 10.8 million of that was allocated to coastal COC. I've highlighted here the projects that are specific to Sechelt. So you can see there at number 10, the water resiliency project is one of them. At number 2, the replacement of the mechanical switchgear and emergency generator. I just want to make a quick comment on that one. We have been to your board at least twice on that project. This was a request for another additional 300,000. We've opted not to put that forward to you for a cost share request. So VCH will be taking care of that additional cost request 100%. The focus of the FY25 capital plan is really the completion of the master site plans or health visions within the rural areas with robust engagement with the First Nations. We continue to address the deficit on the infrastructure and develop further plans for long-term care to address the demand. And then on the equipment side, We have gone through a deconsolidation of some of our services with medical imaging. So we are putting a renewed focus on a replacement strategy for some of our large medical equipment pieces. And on the IMITS side, we are transforming some of our voice systems across the health authority. And as I've mentioned before, we are focused on a provincial ERP system, which is very well overdue for the health authorities as a whole. Our systems are 20 years plus old. This is a very, very high-level view of the 25-year capital investment that has happened within the health authority. And as you can see, the priority investment projects, which is the new growth and the new build, they really kind of started to show up around 2014. With quite a bit of work happening into the future here. And what is included in these numbers are things like the new St. Paul's Hospital. We have the redevelopment of the Richmond Hospital, various long-term care facilities, land acquisitions, etc. Then I'm just going to go and give you a bit of an overview of the active projects that we have currently underway, both on the facilities and equipment side. Just to orientate you around the view of this slide, when you're looking at the middle section, the budgeted funding sources, and you'll see the Sunshine Coast RHD, those are the commitments that have been made to date on cost share projects. It also includes at items number 6 and 7, the 2 projects which we are going to table to you for cost share today. Things such as the security upgrades in Sechelt and Gibsons, we are not approaching the regional hospital district for a cost share on those. And interestingly, on the equipment side, we have had quite a bit of spend on the minor equipment that's contributed from the Sunshine Coast RHD. I'm trusting that some of the numbers has actually flown through here. Very important also is the major contribution coming from the Hospital Foundation and auxiliaries. As you can see, a 43% contribution on equipment. It's the largest of our total allocation. So thank you to all of you for that. And then the projects that we have closed within the last 2 years, 2 of them, I think, which is important to you, are the chillers and the oxygen system, and the window replacement. Those projects have completed. And then we are getting to the cost share request. So the 2 projects that was mentioned earlier is the dishwasher replacement at Sechelt Hospital for a price tag of $871,000, and the water resiliency project at Sechelt Hospital for $750,000. And I'm going to hand it over here to Sam to actually speak to those 2 projects in a little bit more detail.
Thank you very much, Johan and Chair, for inviting us. Essentially, the dishwasher replacement, this is the kitchen at the hospital that is from the original build, and it's due for replacement. And the scope of work essentially includes upgrading the HVAC, flooring, the actual dishwasher equipment, and essentially bring it up to code. The second project is water resiliency, which, as I recall, it was important, and it was brought up in the last meeting at the regional hospital district. And essentially, this is two aspects to it. For VCH, our approach is firstly, as a consumer of water, we'd like to look at areas where we can upgrade some equipment that would reduce the consumption of hospital water. And secondly, building some infrastructure that, in case of an emergency, allows for additional potable water to be brought in and connected to the hospital system. And essentially, that will entail is building a pump and some piping and other infrastructure that would allow that.
Thank you.
Thank you, Johan.
And I'm going to give Sam here on the next slides as well. It's the Sunshine Coast capital priorities that is coming up.
Thanks again. So one of the major initiatives that Vancouver Coastal Health has on the go is developing a health vision for the Shisha and Seashell Hospital. And essentially, what this exercise entails is that it looks at the next 30 years and looks at the services that are provided at the hospital currently and what the community needs in the future, and allows us to have one consolidated report to look at what the areas of priority are, so that when the funding becomes available, we can quickly act. What the exercise specifically entails is it develops a clinical services plan. It looks at data, essentially, that looks at what are the services that are currently being developed, being offered at the hospital, and what are the services the community requires in the future. And the next step of the exercise is developing a functional program based on the clinical services plan, which allows us to inform our decisions as to how much space do we actually require for those services and what options do we have on the campus. These efforts are guided by significant consultations on the stakeholders that are involved, members of the community, Shisha Nation, and as I understand, everything is progressing well. More work is needed to complete this exercise, and our forecast completion for this exercise is March of 2025. The next category looks at the upcoming priorities. And one of the major projects that has been brought up to VCH as being a concern for the community is, of course, Totem Lodge. As we all know, currently the space is vacant. And following a building assessment report that was completed for this building, it was concluded that the building still has some good life in it. It does, however, require some infrastructural upgrades, which also gives us a good opportunity to advance those upgrades as the building is currently vacant. As you're well aware, if the building is not vacant and there are patients in it, there are significant infection control practices that are required, which translate to cost. So we are looking at this as a significant opportunity to advance those structural initiatives as soon as possible. And where we're at with that is that we're almost at our IFC package stage that's issued for construction package, where we can engage a contractor to start doing those upgrades, which are needed regardless of the use of the building. Now, the second part of this exercise, of course, is what is it going to be repurposed for? And what we are currently doing based on evaluation of a number of priorities, VCH has determined that the best use of the building would be providing additional space for mental health and substance use, and some of our and space for the community efforts that are required to supplement that. So we are doing this work in parallel with infrastructure upgrades. We've engaged an architect who is looking at that various options for test fit to see how we can best optimize it. Our challenge is that we are constrained by the footprint of the building because of the urgency, and we want to repurpose the facility for the community as soon as possible. So the exercise is trying to optimize that effort. So as soon as our design efforts on that front are completed, we'll advance into construction. And there are two other projects that I see on the board is building maintenance building maintenance systems that require upgrade. And again, these are originals for the hospital, and they're due for replacement. And then one of the elevators is also due for renewal. Thank you.
Thank you, Sam. Then the last section of the presentation is really just speaking to the annual prioritization process. So I will go through this very briefly. When we are looking at capital, we kind of look at the risks and we look at the opportunities. So from a risk perspective, we are looking at expanded services. When we are looking at the timelines associated with those, the challenges, and I think as Sam has alluded here, when we have a facility that's occupied in use, it becomes very challenging. So this really fits into this opportunity here. The infrastructure as a whole, we have been very fortunate through CST and the rollout of that project that really supported a lot of our IT core infrastructure upgrades. So those are in a fairly good shape at the moment, but we continue to do these infrastructure upgrades, i.e. the dishwasher replacement. From an opportunity perspective, we are looking at sustainable capital strategies. It is challenging because we are limited in terms of our ability to really move outside of our funding envelope. By that I mean we don't have the ability to go and borrow money to do something. That is not an option to the health authority. So when you're looking at our capital resources, we are constrained with what we receive. And don't, so when we are looking and talking about sustainable strategies, we are looking at things that we can potentially lease, different financing options that we can get into. And to tag on to what Sam was alluding to is the health visioning and how that is going to deliver for us some future strategies in terms of investment opportunities. And then we continue to build and strengthen on the partnerships with the First Nations and First Nations Health Authority. I won't go over all of these, but this is typically the prioritization criteria that we go through when we are assessing projects for the intake. Our intake process is basically on the cusp of being implemented for next year. So this forms the core elements that we look at. And this is a scoring approach. It changes sometimes from year over year, but we have had this allocation for the last 2 years in place. And this is probably the more important piece is the kickoff of the prioritization process for next year starts in September, and it really concludes around the end of January with seeking board approval around February, March timeline. And I will skip over these, but it's more informational if you are interested in that as to how to apply the actual scoring tool and what we use for that. So with that, I conclude and happy to take any questions from you. Thank you. Thank you, sir.
Okay, I've got some questions myself. I'll go to Director Inkster first.
Reminds me of our council meeting last night. Yeah, a question for you. Shorncliffe, is that within your purview?
Yes, the question's for me, right? Keep in mind, it's through the chair.
Sure.
Yes.
Sure. I can do that. So Shorncliffe, is that your purview?
That's how we're supposed to do it, yes.
Yeah. And where is it on the ranking then of the needs assessment that was presented earlier?
I think I can answer this, but maybe VCH can update. But Shorncliffe, the capital assessment was also done on Shorncliffe, and it was basically, I mean, to really generalize it, it was determined that it's not feasible to do kind of immediate work there. It's going to take some longer planning and be part of a longer term planning process to determine what repurposing could possibly done to Shorncliffe and how that will look. I think that's, if there's any other update on that.
That's exactly right. And we have arrived at that conclusion based on the building assessment report, as the chair alluded to. Thanks.
Okay, so just to follow up to that then. So VGH is VGH, Vancouver Coastal, is waiting to see what to do with that, but obviously the decision makers are aware that the building, the grass is growing up, the trees are growing, the building could be relatively in similar decline. So I guess they're aware of that as they make decisions. So hopefully decisions regarding that facility, whether it's used as is or not, is soon. Through you to, yeah.
Yeah, I guess is the building, is there some, I mean, it is a concern that it does seem to be, it's presumably being completely abandoned now after a long time. Is there some, regular maintenance going on? And would be a part of a question too, of making sure it's kept up during this time.
I would have to check with our maintenance and operations team on that. I am aware that they've taken some measures to ensure the building is protected, but in terms of the maintenance, I have to look into it. It is certainly on the radar that this building exists, and as the chair alluded to, it will be the use of the building or repurposing it or whatever future it's going to have. It is going to be evaluated as part of the health vision exercise for sure, as one of the assets.
Which ties to the correspondence about the health visioning that we have going. Director McMahon.
Yes, sorry. So with mental health moving into the totem facility, that presumably frees up the footprint of the portables that are there right now. Is there a strategy for what can be done with that part of the campus?
Thank
Go
you.
ahead. Yeah.
Thank you, Chair, and thank you for the question. Director McMahon, the reality is, unfortunately, that even with utilizing Totem, we're still strained from a space perspective. Certainly, it is our intention to move as much of the services from the trailers into Totem, but we'd like to defer that final decision to see how much of the services we can incorporate into Totem and whether we can reutilize the portables for another reason or remove them from the site.
Director Stamford.
Thank you, Chair. I noticed in one of the projects, specifically around the dishwasher replacement, that part of the concern is that there is mold and humidity problems. Will the renovations rectify that? Is that the expectation?
Thank you, Chair, and thank you for the question. Yeah, absolutely. That's one of the drivers of this, and it will be remediated. And all the mold and anything that is currently existing and cannot be maintained will be removed.
Director Lee.
Thank you, Chair. I was curious about the 3-day, I think it's just tanks that can be refilled by trucking. I'd be curious if that was correct. And I was also curious if other hospitals have that capability.
Thank you. I was going to ask some questions about that myself, so that gets us started on that. So this is about the water storage.
Yes. Again, thank you, Chair, and thank you, Director Lee. Currently, there is a contingency plan for the hospital that there is a contract in place with another company that if, in case of an emergency, water is required, essentially that capacity is put aside for us, and it will be transferred to the hospital. However, on the long-term vision, that's where this new project comes into place that allows for an infrastructure to be in place so that the potable water can be incorporated into the hospital water system.
Yeah, some of my questions related to that. One are firstly, is VCH working with the SCRD as the water purveyor, the regular water purveyor, on this project of having backup potable water, or is the kind of philosophy and approach more that this is an emergency situation, assuming that the SCRD system would fail in that kind of emergency situation, so you'd have to look somewhere completely elsewhere for water?
Thank you, Chair. This is a question for our maintenance and operations team, and if I may, I'd like to take that as an undertaking and get back to a regional hospital district. From my understanding, yes, there has been some conversations, and I understand that the regional hospital district has also taken some measures to address and improve availability of water, whether through allowing for additional wells and so forth. But if I may, I'd like to take that and do a little bit more research and get back.
Okay, yeah, I guess, one reason I'm asking is wearing our SCRD hats, which is, we'll be doing in 5 minutes. We'd probably be particularly concerned about, whether we should fund this or not, or support the funding of it, based on whether, it's determined by our infrastructure staff that this works well with the water provision system on the Sunshine Coast provided by the SCRD, and it is indeed the most efficient way to do it when we might have our experts in our infrastructure department might have other suggestions. So I think we'd want to be really assured that all those communications have taken place and that this is endorsed by our staff as the best, the optimal way to provide backup water supply.
Yes, I understand and makes sense, and we'll take this opportunity to get back.
Thanks. Director McMahon?
Of course, we hope this is a water-efficient dishwasher system going in. I actually have a question for the chair, since VCH is here under our current MOU. We had a discussion with the other regional hospital districts about renewing the MOU. Where do we stand with that? Because I think it may have expired, or it certainly be very close to expiring.
Well, I'm gonna send that one over to VCH because it's in draft form. And I don't think it's in a draft. It's not quite in a draft that's ready to share with the board last time I heard. So an update would be very helpful, I agree.
Yeah, Mr. Chair, yes. The MOU is being worked on. Sean Parr is the one that is leading that initiative. I know that there is one of our legal specialists is also focused on it, but I have to say I am not sure about the timeline of completion because it needs to be sent back for feedback to all three of the regional hospital districts. Thank you.
Well, please take that question as an indication we're keen on seeing it. It has been a while since it was requested, so hopefully maybe Sean can be reminded. We're hoping to see that soon. Director Lee.
Yes, it's kind of a follow-up to my earlier question. I'm a little concerned about being a water purveyor outside the RD and the safety that's associated with that. It kind of alarmed me. They're already in the hospital, so I think we have to be quite careful with that aspect. So,
Thanks for echoing that. Yeah, I think that's aligns with the points I made about our infrastructure staff really needing to be on board with this proposal. Director McMahon.
Yes. It's good to be reminded of our limitations. For whatever reason, I didn't realize that the health authority can't borrow, which in fact makes the regional hospital district board make more sense, because I've always wondered what the heck we're doing here. But our limitation is that we cannot fund anything that's not on the hospital campus. Hence my question about the portables. Because what we need urgently in this community is long-term care. And although there have been motions to UBCM asking the province to look at revising the Regional Hospital District Act to allow us to fund healthcare facilities that aren't on the campus, I don't see that that's going to happen anytime soon. So, you know, obviously, if you have projects that we can fund, then that's better for everyone. Just pointing it out.
Thank you, Director McMahon. Johan, did you want to comment on that? Okay.
Just to thank you.
Okay, yeah. I've got a question for our staff too on this, just based on the requests. I'd like to ask just for a helpful reminder. It's always good to have this every year and framing this. What the hospital regional district, we saw the criteria for VCH's priorities, but what is our criteria usually for what we are looking to fund and feel justified in raising local taxation in order to fund?
Thank you, Chair. So there are a few policies, and there are very few policies for regional hospital district, and some are related to minor capital and major capital. And so essentially, there's nothing definitive, like there's no definition other than essentially a value and criteria in accordance to the Hospital District Act, so what we're allowed to fund. So it's very generic. There's not a lot of parameters associated with it, and I think that there's an opportunity if we want to be more definitive. Other reports that we've also brought to this board before has been what do the other hospital districts do, even within our MOU? And there's quite a divergence of how people go through their process, what they do. I know Johan has to tailor his process to each of us. So it would be a good conversation to have, and I know it's come up at some of the governance sessions that we've had with the other RHDs, is how do we all do this, and should we be consistent? Should there be a definition? Just make it easier for our partners, including our partners in the room, which is the other funding partners with Vancouver Coastal Health. So working collaboratively and having a definition, what we fund versus what others fund would be helpful.
Thank you. Yeah, I've heard that before. This is kind of a chronic challenge of trying to sort out our roles, and I see others who help fund from the community here as well. So I know it's a constant question for everybody. I think when we look at the requests, the water resilience does clearly brings up some question marks for us, and just ensuring that that's really well aligned with what we offer and the professional expertise at the SCRD. I think, in addition, I appreciate that the repurposing of Totem has been brought up, and that's something that's on the radar, and I'm hearing that some costs on that are going to be determined quite soon. Is that a possible option or for a funding request this year, or are we being told that that's something that's coming? Is that?
Mr. Chair, if I may, it's going to depend on actually when we get that cost estimate. I'm going to go off the assumption that it's going to be in the multi-million-dollar range, and it will require a VCH board approval. It will require a business plan. It will be quite the process. If there is anything that's going to be spent this year, it won't be substantial. But it is a great opportunity to partner with you on that, let's call it repurpose.
Okay. So I think we do need a direction out of this, a motion to consider the request for our next meeting. We don't have like a draft template for this in our agenda here, but I believe I understand from staff that we need staff to have a look at the funding request and actually have that ready for consideration at our next hospital district meeting. I'm looking to our staff to clarify that.
Yeah, thank you, Chair. So I think a motion to refer the items to the October RHD meeting for funding considerations is typically what happens at this particular time. Thank you.
Okay, and I'll ask if the board is interested in any other options or considerations, please add those to the motion. We've got two requests here, so go ahead, Director Inkster. So that's moved. Director McMahon?
I'm fine with moving that. I'm just wondering whether we wanted to say anything further about the water directing staff to work with the VCH on the water efficiency project.
Okay, Director Inkster, I'm going to take Director McMahon as seconding that, but with that, further that, that works for you? Okay, so that's our motion, that we make that request with the addition that we ask staff to work with VCH on determining the optimization of the water resiliency project that's being proposed. Yeah. Any more discussion on the motion? All those in favor? That motion carries. And next we have communications, and this is a letter from Darlene McKinnon, Vice President of VCH, regarding the health vision. Now, in one of my other roles, both mayors were consulted on this health vision to comment on behalf of the municipalities. I think the chair of the regional district was consulted separately too, or that offer was made. I'm looking down the line there.
I honestly can't remember.
Don't remember? Okay. But anyway, regardless of that, there's more opportunities here for anyone at this table or the broader public to have some input into the vision. So that's really what this correspondence is reminding us of. And we need a motion to accept that as part of the agenda and other materials as well. Moved by Director Inkster, seconded by Director Gabius. All those in favor? That motion carries. Any other discussion on the correspondence? Okay, a question on that? Director McMahon?
Yeah, I couldn't find a date. How long is this survey open? Does anyone know? Because I cannot find a deadline to respond to the survey.
Thank you for the question. I don't have the exact date. I believe it should have been shared as part of the instructions, but I can double check with our communications team and get back to you.
Maybe if there's an email about, I'm sure there are a lot of communications going around about this health visioning, so if we can find the most recent one with a date, let's just share it. Let's find a way of sharing that with the whole board. We'll do that. And next, we're on to adjournment. Moved by Director Toth, seconded by Director Gabius. All those in favor? The meeting is adjourned. Thank you.
Thank you.
Thank you very much.
Thank you.